I usually use a laparoscopic approach to treat a hernia. For a laparoscopic approach to a hernia, the patient goes under general anesthesia. I make a small incision, approximately 5 millimeters in length, and where that incision goes very much depends on where the hernia is located. I'm able to inflate the belly with gas. It's warmed, humidified carbon dioxide gas, and the abdomen is inflated with the gas. I then put a thin tube through that hole. That tube is called a trocar. I'm able to insert a very long, skinny camera, and so that starts the operation. Now, to do the operation, I need to get my hands in there somehow, and so typically what I do is to put 2 additional trocars in the abdominal wall. So for most hernias, I'm able to do this with 3 tiny incisions. And then using long skinny instruments and a camera, I'm able to see that hernia and fix it from the inside. My general approach is to close the hole in the abdominal wall with suture, followed by a large pore, lightweight mesh, which is thin, floppy, soft, but very strong. And I'm able to put that in to reinforce the repair. The reason why I use a prosthetic is that it reduces the recurrence rate after hernia repair. If you repair an incisional hernia with suture only, the recurrence rate is again approximately 1 in 5. Recovery time depends on what kind of surgery we're talking about. I usually counsel my patients to not lift anything heavier than 10 pounds for 3 weeks. To not do any heavy pushing or pulling during that time either. After that time period, I say, expand your activity level gradually but fully with pain as the guide. So I like to have it, I like the post-operative functionality to be increased by the patient with reference to their pain. So in the 4th week, are you having pain when you lift something slightly heavier than 10 pounds? If the answer is no, go ahead, expand your activity level. When it comes to hernia, I want patients to be more functional after I operate on them than before. Often, for a very functional patient in the preoperative period, that's quite challenging.